The concept of second victims was introduced 20 years ago to draw attention to healthcare professionals involved in patient safety incidents. The objective of the ERNST consortium was to develop a common definition that is state-of-the-art, is based on available evidence, and that is supported in consensus by experts in the field. And that is what we have done. We included 83 different papers in our review and developed the first version of the definition. That first version was in detail discussed with a core group of leaders from different countries and from different disciplines. We included 29 experts from 17 different countries. Based on their expertise and experience, we came up with an evidence and consensus-based definition of second victim that was peer-reviewed published in December of 2022. The European Research Network, working on second victims, concludes that a second victim is nowadays defined as any healthcare worker directly or indirectly involved in an unanticipated adverse patient event, unintentional healthcare error or patient injury, and who becomes victimized in the sense that they are also negatively impacted. Let us dig in deeper in 3 different parts of this definition. Any healthcare worker directly or indirectly involved. This means that all multidisciplinary and interprofessional team members can become second victims, not only doctors and nurses, but also allied health professionals, cleaning personnel, volunteers, administrative support, and the management. These healthcare workforce members were directly or indirectly involved, so also members of the team who were not directly involved in the event can suffer in the aftermath of such an event. Secondly, we talk about unanticipated adverse events, unintentional healthcare error, or injury, patient injury that was unexpected. All of these types of events can lead to an impact on the healthcare professional. So we are not only talking about proven medical errors, but a broad range of incident types or even patient injury because of unforeseen and unintentional complications. Thirdly, we focus on healthcare workers who become victimized in the sense that they are also negatively impacted. As discussed in other ERNST working groups and in our work on support systems, healthcare workers are negatively impacted on psychosocial and professional level. But important in this part of the definition is the word also. With also we mean that the healthcare professionals are not the only and certainly not the most important victim of such unanticipated events. We hereby express that the most important victim of such an event is the first victim, and the first victim is the patient and/or the loved ones of the patient. So let us conclude with some main messages. First, we developed an evidence-based and consensus-based definition, including the recent literature and many international experts. Everybody supporting patients can become second victim. And thirdly, and most important, first victims remain the most important victims of incidents, but healthcare workers need to be respected, and many of us need support in the aftermath of such an event. We hereby hope that the new ERNST definition will support all stakeholders involved in the field of quality and patient safety.